The topic I'm going to talk about today is something that's extremely common but isn't always talked about frequently, and that is constipation. I'm going to talk about kind of two parts. In this first part, we're going to talk mainly about identifying constipation, the causes of it, what's normal, what's not normal. And then in the second part, I will circle back around in November and talk a little bit more about what to do and how we treat it conservatively. So constipation is actually the most common GI complaint that Americans have. So about 4 million Americans experience constipation, and about 2.5 million make physician visits per year. It can occur, so it basically occurs when the colon absorbs too much water, or the colon's muscle contraction is slow or sluggish, and or if there's a delay in transit time through the colon. So keep in mind the colon is also known as the large intestine. So this is an area during the digestion process where it is absorbing a lot of water. But with constipation, we're noticing that it's too much water that's being absorbed and things are just really, really slow moving through the system. The result then is that the stool can be very, very hard and very dry and very hard to pass. So I'm going to go over some indicators for constipation, or even what we would consider criteria that physicians have to diagnose constipation. And this needs to be happening to be truly constipated, for it to be a chronic condition, to be occurring for 3 months. And at least 25% of the time, people are experiencing at least two of the following. And that includes straining during bowel movements, the feeling of incomplete evacuation, having lumpy or really hard stools, the sensation that there's something blocking, that there's kind of a blockage in the anorectal canal, manual maneuvers to empty, so also known as like splinting or pushing up on the perineum to get the stool out, or having fewer than 3 bowel movements per week. So I know that's about 6 different criteria, but having 2 of those 25% of the time when we're trying to go to the bathroom would definitely warrant that someone is having constipation. Keep in mind that if there is a change, if you have a change in your bowel habits, such as an increase or a decrease in frequency or size of stool, or if you're noticing blood in the stool, or even an increased difficulty in evacuating, you definitely want to see your provider. So that definitely warrants a medical assessment and intervention, just to make sure that everything is okay systemically through the GI tract. So let's kind of talk about what are normal bowel habits, because everyone's actually kind of all over the map, and a lot of us don't really know, well, what is normal? We kind of know what we do, but we don't necessarily know what is considered normal. So for most people, it's normal to have bowel movements that can occur 3 times per day, or sometimes even 3 times per week. So normal stools should be about the size and shape and consistency of a ripe banana. So again, everyone can be a little bit different, and we always say, you know, what has been your normal your whole life? Has anything changed since then, and why? But basically, you know, we can be a little different. I may have different bowel movements or frequency compared to someone else. And then keep in mind normal stool consistency. We call it a type 4, which is considered the Bristol stool chart. If you want to look that up, there are 7 different types of stool consistency we can have. But a normal stool consistency should be, again, the size and shape and consistency of a ripe banana. So not too hard, and we're not straining a lot to empty. So Let's kind of talk a little bit then about causes of constipation. A lot of these most of us know, but there are some points on here that I think are maybe we haven't thought much about. And one cause of constipation would be limited fluid and fiber intake. And that is one that is really pretty treatable. I mean, if we can identify, hey, I'm not drinking enough fluids, I'm not drinking enough water, or maybe I'm not, my diet's kind of poor, I'm eating a lot of fast food lately because I'm traveling, this, that, the other, those can be reasons that we're noticing some constipation. So easily, should be pretty easily fixable if we can increase our water intake and increase fiber. Another cause would be imbalances in diet. So kind of to go along with that, having too much sugar in our diet, too much animal fat in our diet, those typically can contribute to constipation. Sedentary lifestyle. So if we're sitting around, we're not getting much exercise, we're not moving much at all, that can really impact how things move through our system, or also known as peristalsis. So if we're moving, that really helps with blood flow and can help with the digestive process. Repeatedly ignoring the urge to have a bowel movement. Sometimes we'll see this with younger patients, or even the pediatric population, or even older patients where they might have a fear of having to use the bathroom out in public, or when they're at school or when they're at work, there can be a little bit of fear there, and they feel an urge to go, but they elect not to go to the bathroom. So what typically happens is everything kind of just sits there, and when it sits in the colon, as we know, for too long, you get too much water absorption. So that stool gets really, really hard and really dry. And so it's going to be really hard to empty. Slow movement of stool, too much water absorption. I think we kind of talked about that. Lifestyle changes such as pregnancy and travel. So travel's a big one where we're changing what we eat, we're changing what we drink, when we get up, if we have to catch an early morning flight, we don't have time to go to the bathroom, or a lot of those changes can affect our motility. Pregnancy is another big one. You have a lot of different hormonal changes which can affect our gut. So all very common. Speaking of that, my next point is the luteal phase of menstruation. So after ovulation, but before menses, or before we get our period, that time frame, we have a high increased surge of high progesterone. And progesterone is a hormone that can definitely create constipation. So for women, we might notice, hey, like after I ovulate, but right before I get my period, or a few days before my period, I'm really having to take more stool softeners because I'm constipated, and that's very hormonally based. Laxative abuse. So this is interesting. This is kind of where we see people that are consistently taking laxatives because over time they stop working, so we have to take more in order to get an effect. And unfortunately, this kind of messes up our GI system if we're taking excessive amounts of laxatives, and our body kind of doesn't know how to move things through on its own. It has to rely so much on the laxatives. So we'll actually see a problem where people end up getting constipated because of too many laxatives that they're using. IBS, irritable bowel syndrome, there can be diarrhea dependent or constipation dependent. Certain medications that we take, we definitely know that pain medications are a big one. So opioid use can definitely get us really constipated. Antihistamines, so allergy medications, antacids for reflux, calcium and iron supplements. All of these things, just to kind of name a few, but a lot of our medications, we find that constipation or GI changes can be a side effect of them. Certain conditions, including diverticulosis or having colon polyps, tumors, celiac disease, a lot of these things I just mentioned can actually narrow the anal canal and can create difficulty evacuating or difficulty emptying out. Or again, the stool can kind of get stuck there. And last but not least, being a pelvic floor therapist, of course, I'm going to mention pelvic floor muscle overactivity or dysfunction. So if our pelvic floor muscles are overactive, if they're tight, if they're restricted, that can be a big problem with being able to empty. So pelvic floor muscle function, a healthy pelvic floor should be able to contract really well, and it should also be able to relax and lengthen out as well when we do go to the bathroom. So if we're having a hard time with muscle lengthening, then it's going to be really hard to get stool out, especially if that stool's really hard. And then we talk about dysfunction, meaning if there's tightness, but also if there is what we call a paradoxical contraction. So instead of lengthening your pelvic floor, when you go to sit on the toilet, you're actually contracting and doing the opposite. And obviously, we want those muscles to relax. We want everything to lengthen out. So if we are not coordinating that well enough, then we're going to have a really hard time emptying, or we're going to be leaving behind stool all the time. And if we're leaving stool behind, it's going to sit there in the canal and dry up and get hard. So that last point is definitely something that can be addressed therapeutically, and that's what we specifically focus on here in the clinic, is identifying if someone is having a hard time lengthening out and getting those muscles to relax in order to effectively empty. So now that we've kind of talked about identifying constipation, so we went over indicators for constipation, and again, that was the straining, the hard stools, the feeling like we're not evacuating, like something's stuck there, manual maneuvers that we do to empty, and then less than 3 bowel movements per week. So those are indicators of constipation. And then the causes we just went through, including things that we can adjust for, like diet and behaviors and fluid intake and lifestyle things that we can adjust for. Those are kind of ways that we would address it. So stay tuned, because in November we're going to talk about part 2 of constipation, and we'll talk about ways to treat that from a conservative standpoint.